guys, welcome back to Medical Coding with Blue. Today's episode is all about medical coding certifications and which medical coding certification is the gold standard and why. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so medical coding credentials. There are so many of them out there, and what do they cover? What does this mean? Which one should I get? There's so many questions about this. So I'm going to take the time today to explain it yet again. I do have many videos covering the credentials and what they mean. I've done breakdowns separately in separate videos of the medical coding credentials, so you can certainly go through the videos and see and listen to what I have to say when it comes to these medical coding certifications. First of all, I will say this though. There is not one certification that makes you better than the other one, okay? There is not one that is better than the other one. Now, I will say there is a gold standard medical coding certification because that is true. But gold standard, I'm going to make sure that I define it later in the episode. But the thing that you have to understand about these medical coding credentials is this. I have been in the industry for 15 years. I have seen people who have medical coding certifications with one association and then some with the other, and then either or. And there's been times when they cannot code to save themselves, and other ones have been very proficient. Other ones have been fantastic coders. So it really all depends on the individual. It has nothing to do with that their credential makes them better. There is not one medical coding certification that does that. One just means that you know a little bit more, okay? It's a mastery credential, and I'm going to get into that here in a second. But first, I will start off by saying this. There are 4 main medical coding certifications in the industry that employers look for. There's 2 major medical coding associations. There's the American Health Information Management Association and the American Academy of Professional Coders. The American Health Information Management Association is a non-profit organization. They are the ones that are involved in the lawmaking process and that kind of thing, and the rules and the updates and that kind of stuff when it comes to medical coding. So they are a non-profit organization. They are widely respected in the industry. And when it comes to the AHIMA credentials, they are very well known, okay? With AAPC, the American Academy of Professional Coders, this is a for-profit organization. They have a lot to do in the industry, but when it comes to like the rules and things like that, that's all AHIMA. AHIMA is all the administrative side stuff too, okay? But when it comes to AAPC, they are a business, and they are about selling credentials, and they're about education, things like that, as well as AHIMA. But AHIMA does not make the push for selling the credentials like AAPC does. I say this because AAPC offers a wide array of many different credentials that you can sit for. However, I will say this, they do have their flagship credential, which is the CPC, or the Certified Professional Coder. Now, this says that you understand outpatient medical coding, that you can work with the ICD-10-CM, which is a diagnosis coding. You can work with the CPT manual, the current procedural terminology, and you also can use the HCPCS manual, right? That's all your durable medical equipment and additional services that don't quite fit into the CPT manual, okay? That says that you can do that. Now, with AAPC and the CPC certification, if you have no experience in medical coding when you first get this, you will have an apprentice status attached to that CPC for the first 2 years, okay? They want you to be working in the field for 2 years before you can be a full-fledged CPC, all right? Now, there are some programs that are in conjunction with AAPC. And if you go through this particular program and you also complete Practicode is a set of records that you can use to educate yourself after you've completed your program or while you're working through your program. You purchase Practicode, and as you work through there, it's not multiple choice. It's meant to give you more practice. These are real world redacted records that you will go through and you will code out. And when they say when you complete this, this is equivalent to 1 year of what a medical coder would do. 1 year. And so this is not considered work experience. This is education. No matter what anybody tells you, it is education. And some employers will take education in lieu of experience. Okay, so that's something you got to know. When I write resumes, I always make sure that I put that if the person went through that and it can fit onto their resume, I will go ahead and put that on there that they completed Practicode or they're working through Practicode. Okay, but Practicode is just meant to be that. It is an educational product. But if you go through this program that's affiliated with AAPC and you also you complete Practicode, when you take your CPC, you will not have an apprentice status, right? Because that's part of the deal. And you'll be able to be a full-fledged CPC once you've completed everything. So there is that opportunity to be able to do that. However, I will say this when it comes to that. There is nothing wrong with the apprentice status. It just says that you're brand new. And guess what? Even if you went through an approved AAPC program and you also completed Practicode, you still have the problem of having no experience. So whether you have a CPCA or a CPC, your chances of getting hired are still the same. Okay, it really all depends on where you are applying and how proactive you are being. What does your resume look like? There are a lot of things that go into this. Okay, so that's just something that you gotta know. All right, but that is AAPC. Now they do have a bunch of other credentials that they do offer. I'm not going to go into them on this episode because there's too many of them, number one. Number two, typically when I'm making this type of video, I'm talking to brand new medical coders. So when I tell people all you need is one certification, if that's what you want to go through, AAPC, that's fine. But just make sure that you start off with one certification for at least the first 2 years so that you can get your feet in the industry and you can understand what's happening, instead of being like the people who write to me and tell me, Blue, my instructor told me that I should get 4 or 5 different credentials so that I can get hired faster. I want to sneeze. Excuse me. I want to get into the industry, and so they told me to get these 4 or 5 credentials, and then all of a sudden I can't find a job and I have all these credentials and I don't know how I'm going to be able to maintain them. So don't be like that, guys, okay? Just get one. Make it easy for yourself. And that's just what I'm going to leave it right there. So with the American Health Information Management Association, there are three credentials that you can sit for. Now, watch this. The CCS is the gold standard of medical coding credentials, and I'm going to get into why once I explain what each one of these are. The CCS says that you have mastered inpatient and outpatient coding. This says that you are proficient in coding in the outpatient setting, which is using your ICD-10-CM, your CPT, and HCPCS, right? HCPCS coding, even though you don't need the HCPCS book for the CCS or the CCA exam, just making sure that's out there. And you are also proficient in using ICD-10-CM and ICD-10-PCS, and that is the inpatient procedure coding manual, okay? ICD-10-PCS is a lot trickier than the CPT manual. So this says that you can code for inpatient or outpatient, that you know MSDRGs, DRGs, all these things, right? APCs, you know it all, right? And so that's where the CCS is. That is the gold standard of medical coding credentials because this says that you have mastered it. This is an industry thing, not a Blue says. This is literally the industry thing. If you look in the job listings, you will see that this is asked for quite a bit because this says that this coder is versatile, that they can go anywhere, inpatient or outpatient, okay? So that's something that you got to keep in mind. Now, there's also the CCA. The CCA is the entry-level competency exam for AHIMA. Now, do not let the entry level throw you. I had this credential, I had the CCA for 13 years, and I proudly held on to it for 13 years, and I would probably still have it today if I didn't have stuff going on in the back, okay? But because I did have to put it to rest, and I got my CCSP, which I'll explain what it is here in a minute. But the CCA has the most domains of all the medical coding certification exams. Now, I know that AAPC has theirs broken down by subject and how many questions it has, but if we were to, consolidate that list into what it is, which is the CPT coding, you will see that the CCA, or the Certified Coding Associate, does indeed have the most domains of all the medical coding certification exams, because it is testing proficiency and competency in inpatient and outpatient coding. So again, this says you know how to use the ICD-10-CM manual, the ICD-10 PCS manual, and the CPT manual. All right, so this covers all of that, inpatient and outpatient coding. You can go anywhere. All right, that's all that says. Okay, it is a very great and worthwhile credential. Again, I had it for 13 years, and again, I would still have it today if AHIMA let me. But once you get another credential, the CCSP or the CCS, the CCA will automatically be superseded, okay? Which means they'll take it away from you, and they'll just, you'll be with your current credential. So, but you cannot hold another credential, the CCSP or the CCS, when you have the CCA, okay? That does get superseded once you get one of those, all right? And it's not a bad thing. It just says that you have hit that next level with AHIMA, okay? So the CCA is a great credential, and so is the CCS. And both of them cover ICD-10-CM, ICD-10 PCS, and CPT. Now, for the last one, the CCSP, the Certified Coding Specialist, Physician-Based. This says that you have mastered the outpatient setting coding, so that you know how to use ICD-10-CM, the CPT, and the HCPCS, HCPCS Level 2. You know how to use those three manuals, okay? And it's all outpatient coding, all outpatient rules, everything, okay? So that is covered on the CCSP exam, the Certified Coding Specialist Physician-Based exam, okay? So that's what you have to know about that. Now, like I said, what is the gold standard of medical coding credential certification? That distinction goes to the CCS. Now, what does gold standard mean? Gold standard means that you have mastered inpatient and outpatient. This means that you can literally be dropped in anywhere because your credential says that you have mastered both inpatient and outpatient coding. Now, I had somebody comment and tell me, well, Blue, my instructor says that the CPC is the gold standard of medical coding credentials. The CPC only says that you know outpatient coding. It does not include anything about inpatient coding. And so in order to be well-rounded and proficient in medical coding, the CCS says that you have done both, that you have mastered both, okay? Even though sometimes you may be going through a program that's really great, or maybe you're even self-studying, and you manage to sit for this certification, the CCS, and you pass it, it's saying that you know and you're competent enough that you've mastered it all, right? You've mastered both subjects. So that's good. But again, guys, somebody saying that, oh, the CPC is the gold standard, that is their opinion, all right? And just like it is my opinion to say it as well. However, I will say that when you look at the job listings, the one that is asked for time and time again above any other certification in medical coding, right? The CCS, CCA, CCSP, or the CPC, not the degree designations, don't holler at me for that. But the one asked for time and time again is the CCS. That can stand alone by itself, and it says that you have mastered inpatient and outpatient coding. That is why I say that that is a mastery medical coding certification, because it is, and it is the gold standard, in my opinion. Okay? So when you hear that, it's fine, guys. But keep in mind who's saying it and why are they saying it. Are they saying it because they're just trying to draw up, okay, we're trying to draw up the support for AAPC. I have always said I support both associations, even though I have nothing to do with AAPC. They do not pay me. I am not a volunteer. I am not certified with them, and I do not I will never be certified with them because I don't have to, guys. I already have a AHIMA that says I have mastered inpatient and outpatient coding because I currently hold the CCSP and the CCS certifications, both, okay? Yes, it's a little bit of the double dip on that one, but only because I got the CCSP first, all right? And at that, I have been a veteran coder for all these years now. And so that is why I have them both, and I'm gonna keep them both, you know. And for those of you who say, well, I want to keep all mine and that kind of thing, you totally can. I'm not saying that you shouldn't, but what I'm trying to help is the new people that are coming in who are confused, who are writing me saying, do I need to get all of these credentials? It's so expensive. Absolutely not. Now, when you get experience and there's something that you want to do that is specialty, like, you know, doing CDI, clinical documentation integrity, clinical documentation improvement, then absolutely you're going to want to level up your credentials and say that you can do that. But that is a whole nother animal. But yes, guys, that's why I will say that the CCS is the gold standard. Please don't tell me, oh, well, this person said this. Guys, it doesn't matter. It doesn't matter. It's never going to change my mind. It's never going to make me stop saying it. I'm going to continue to say it because the reason that I say it is that it says that you've mastered both inpatient and outpatient. And I think that that is truly critical for all medical coders to really understand, not just the outpatient setting, right? But to understand the inpatient setting as well. It gives you more opportunities out there, and it gives you more of those skills that you can put under your coding tool belt. And you can be able to do all those things, guys. You can expand what you do based on your knowledge. And if you have a closed frame of mind, like, oh no, Blue, I just can't do that. Well, then you're always going to be able to not be able to do something. And I don't believe in that for adults. I believe if you want to do something, you can absolutely do it. You can do anything it is that you set your mind to. And even though something may be scary, the scariest things that we have to learn, like, you know, in coding and things like that, and how hard it is, those are the things that are most worthwhile, right? Because doing something that challenges you keeps you moving forward. It keeps you motivated instead of just the easy path. And there are some people who want the easy path, and, you know, there's nothing wrong with it. But however, I will say this, again, my channel is for those that want that challenge. And I'm here to tell you that that challenge is what drives you. It's what gives you passion. I have passion for what I do, that I never want to retire. Okay, there's some people that just cannot wait for retirement, and that's great if that's you. But for me, I never want to retire from this. I always want to have my hand in coding in somehow, some way, because it's what I do, and I enjoy helping adults to learn. I enjoy watching them grow, whether it is fellow medical coders here, medical coding students, or my providers. I like watching people grow and challenge themselves. And that's why I do what I do. So with that said, I'm going to go ahead and wrap this one up. But guys, keep this in mind. People are going to tell you things about these credentials. All you need is one. Okay? And you can be a fantastic coder with even just the outpatient credentials, the CCSP or the CPC. You know, you can be just as fantastic. You can do inpatient coding if you train yourself, even with those. Because like I said, at my facility, all the inpatient coders, they're all CPCs. So I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, I hope that you will like, subscribe, and share. And I will see y'all next time. Bye.